Hello, and thank you for tuning in to this Medicare workshop video. In the video today, you will learn how and when to enroll in Medicare, what Medicare does and does not cover, and you'll learn how to choose the right supplemental coverage for you. After the video, which will go for about an hour, you'll have a great foundation of knowledge about Medicare. Now, for some of you, this may be enough information and you'll be ready to enroll in a plan. That's great. You can enroll over the phone or in person by contacting a Blue Cross agent or by visiting one of our centers located in Edina, Roseville, St. Cloud, and Duluth. Now, others of you may have more questions before you're ready to make that final decision, and that's okay. Most of our members want a trusted person to support and guide them through the process. And that's just what our agents and centers can assist you with. Please feel free to reach out anytime. We're happy to help in any way. Well, we do have quite a bit of information that we're going to be covering today, so we're going to go ahead and jump right in. First of all, I want to go over the topics that we will be talking about. And we're really going to split this workshop into two different parts. During the first part of the workshop, we're going to be covering Medicare Basics. And when I say Medicare Basics, what I'm really referring to is Part A Medicare. That's going to cover you when you're in the hospital. And Part B is in Bravo Medicare, which is going to cover all the services you get outside of the hospital. And those two parts together are commonly referred to as Original Medicare. And I want you to think of that as your baseline coverage. That's your foundation where you're going to start. That's what you're getting through the government. And then we'll move on in the second part of the workshop, and we'll start talking about the plans Blue Cross Blue Shield offers that give you more coverage than what you're getting from the government. And we'll talk about why you might want to consider adding more coverage. And we'll also, throughout the presentation, go ahead and identify some very key criteria for you to take into consideration when choosing which one of those extra supplemental plans is going to work best for you. Now you can see there's 4 different types of supplemental plans that are offered through Blue Cross Blue Shield. The first 2 listed, cost plans and advantage plans, are going to be regional. That means the county you live in is going to determine which one of those plans you're actually eligible to enroll in. And we'll talk about that in more detail as we progress through this workshop. But for now, just be sure you're watching the video that pertains to the county and the region where you live. Now, the next 2 plans listed, Medicare Supplement and Part D plans, those are not regional. So no matter where you live in the state of Minnesota, you'll be eligible to enroll in one of those plan types. All right, well, let's start by going through key enrollment periods. So here we're going to be talking about when you are eligible for Medicare and when your coverage will actually take effect. The first period we'll get into is called the initial enrollment period. And there's a number of different ways you can qualify for Medicare, but by far the most common is simply turning age 65. So those of you listening in today that will be 65 in the near future, this initial enrollment period is going to be important. The initial enrollment period includes the month you turn 65, the 3 months before, and the 3 months after. So it's a 7-month window. Now, if you have been collecting your Social Security benefits for at least 4 months prior to turning age 65, then you will automatically be enrolled in both Part A and Part B Medicare. You'll get a red, white, and blue Medicare card in the mail. That usually shows up about 3 or 4 months before you turn 65. If you are not collecting those Social Security benefits, that's okay. You're still eligible for Medicare, but in that case, you are going to need to initiate turning those Part A and Part B benefits on. And you're going to do that by going through the Social Security office. You're either going to call them or you can go onto their website and enroll in your Part A and Part B benefits that way. And I'm going to have the phone number for Social Security and their web address on the next slide for you. Now, when you are eligible to reach out to Social Security, again, this goes back to that 7-month initial enrollment period window. As long as you contact Social Security during those first 3 months preceding your 65th birth month, then the effective date for your Part A and Part B coverage will be the first of the month in which you turn 65. Now, if you wait to contact Social Security during your birth month or those 3 months that follow, that's okay. You're still in your initial enrollment period window. However, in that case, the effective date for your A and B coverage, that's going to get pushed out a little bit further. The next enrollment period I want to discuss are called special enrollment periods. Now, there's a number of different events that may occur in your life that will open up a window of opportunity for you to either sign up for Medicare for the first time, or in some cases make changes to any kind of extra supplemental coverage you've added on top of those Part A and Part B original Medicare benefits. There's about 20 or so different events that actually qualify as special enrollments. We won't go through all of those today, but I will talk in a little bit more detail about what is by far the most common special enrollment event that I see. And this event would be for people who turn 65, so they are indeed eligible for Medicare. However, they're working and they have a health plan that's offered through their employer, and they want to stay on that employer plan and put off Medicare. Well, you can do that as long as the coverage your employer is offering is what's called creditable. Now, creditable just means as good or better than what Medicare offers. And to find out if your employer plan is indeed creditable, you can talk to someone in your HR department or whoever handles benefit administration at your company. Provided it's creditable coverage, keep working, stay on that employer plan as long as you like. Now, when you do finally decide to retire, that is actually the special enrollment event, because now you're no longer eligible to stay on your employer plan. Now you can contact Social Security, let them know you're coming off of a creditable plan, and you're ready to start Medicare. 2 more enrollment periods to cover. To the bottom left of the slide, first of all, is what's called the annual election period. And this is going to occur every year between October 15th and December 7th. And this is the time of year when everyone who's on Medicare is going to be reevaluating their supplemental coverage. And if they want to make a change and choose a new supplemental plan for the following year, this is the time to do it. Now, that Part A and Part B original Medicare, remember, that's like your foundation of coverage. That never changes. But those supplemental plans, as your needs change or as the plan might change, you might want to look at different options. And again, October 15th to December 7th is your opportunity to choose a new plan for the following year. And finally, over to the right, we have what's called the open enrollment period. And first of all, this period is only going to apply to those Medicare beneficiaries who have elected what's called an Advantage plan. Now, an Advantage plan is just a type of plan insurance companies offer that give you more coverage than what you're getting through that Part A and Part B original Medicare. And we'll talk in more detail about Advantage plans in a little while. But for now, just know if you've elected an Advantage plan, and then during the first 3 months of the year, you decide that plan is not working for you, you actually get a chance to drop it and pick up something else. So easiest way to think about this period is a trial period for those folks who have elected an Advantage plan. On the next slide, as promised, over to the right, I have the contact information for Social Security, both their phone number and website. And I've also included other really good resources here, the Senior Linkage Line and the Medicare Helpline. Again, just good resources for any kind of questions you might have about Medicare. All right, well, let's move next and look at the actual benefits the government is offering through Part A and Part B. And we'll start over to the left with Part A Medicare. Now, Part A Medicare is there primarily to cover you when you're in the hospital. And Medicare breaks this inpatient hospital benefit into 3 different periods. The first period is going to cover the first 60 days that you're in the hospital. For those first 60 days, you have a deductible of $1,556. So you're going to be responsible for the first $1,556 for any covered benefit costs. After that deductible is met, then Medicare is going to step in and they'll pay 100% of all your covered benefit costs for that 60-day window. Now, if you have a little more extended stay in the hospital, the next period gives 30 more days of coverage, and those would be days 61 through 90. Now, for those days, instead of a deductible, you're going to have a daily copay of $389. And then the third and final period gives you 60 more days of inpatient hospital coverage, those being days 61 through 150. For these days, you still have that daily copay, but now it's going to double from what it was during that last period. So it goes up to $778 every day. And I also want you to notice under those last 60 days, days 91 through 150, it says lifetime reserve days. And what that means, kind of like what it sounds like, you only get those last 60 days one time in your life. If you start using those days, you do not get them back. So I want you to think of this Part A inpatient hospital benefit as 90 days of inpatient hospital coverage per benefit period. Now, benefit period is going to start the day you go into the hospital, and it's going to end 60 consecutive days after you're out of the hospital. So let's look at a couple examples to help illustrate this. Let's say you go into the hospital for 3 nights, and then you go home, and 40 days, let's say, after you're home, you need to turn around and go right back into the hospital. Now, it doesn't matter why. It could be related or completely unrelated to why you were there the first time. The key is that you haven't been out of the hospital 60 consecutive days, so you're still in the same benefit period, meaning that second trip back to the hospital is now going to be day 4. So those days are going to keep accumulating. Let's look at another example, and we'll start the same way with a 3-night hospital stay. Only this time after you get home, it's not until 61 days that you've been home that you need to turn around and go back to the hospital. Well, in that example, the second trip to the hospital is actually going to start a whole new benefit period. So in that case, you'll go back to day 1, and you'll also go back to having to meet that $1,556 deductible. So you might have to meet that deductible multiple times in the same year. It really depends how frequently you are in and out of the hospital. But that's your Part A benefit. So let's move over to the right and talk about Part B Medicare. And again, Part B Medicare is there to cover all the services you get outside the hospital. So this could be office visits to a primary doctor, or it could be a specialist. This could be diagnostic testing, like say an MRI, CT scans, ultrasounds, x-rays. This is your preventive care. This could be a trip on an ambulance or a trip to the emergency room or urgent care. So lots of different things are going to fall under this Part B umbrella. Now, the first thing we're going to talk about with Part B is the monthly premium. All right. We don't talk about that with Part A because most Medicare beneficiaries get their Part A at what's called premium free. So there's no monthly cost for most people on Medicare for Part A. But with Part B as in Bravo, there is going to be a monthly cost. In this year, in 2022, that monthly premium starts at $170.10 a month. Now, it can go up to just over $578. So you've got a pretty big range there of what you might be paying to the government to have this Part B benefit. Now, Medicare is ultimately going to determine what you pay based on your income. And quite simply, the more money you make, the more you're going to be paying to the government for that Part B Bravo benefit. Now, Medicare has come up with income threshold levels. So if you are single and your income exceeds $91,000, you're going to be paying more than that $170.10. Married couples filing taxes jointly with an income that exceeds $182,000 are also going to be paying more than that $170.10. And just how much more really depends on how high your income exceeds those threshold levels. Now, you also have a deductible for your Part B services. This is relatively low. It's $233, and that would be for the calendar year. So you're responsible for the first $233 and any covered Part B benefit costs. Now, after that deductible is satisfied, it turns into an 80-20 plan, and that just means Medicare is going to pay 80%, and you're going to be paying the remaining 20% of any eligible covered Part B benefit costs. And those are your original Medicare benefits. Now, just as important as it is for you to understand what Medicare covers, it's really important you understand what Medicare does not cover. So let's go through that next. And some of these bullet points we're going to talk about, we've really already identified. So for example, the first bullet point talking about inpatient hospital days beyond Medicare's limits. Well, we know now that you get 90 days of inpatient hospital coverage per benefit period with those extra 60 lifetime reserve days to use should you need them. But if you exceed those limits, there is no coverage with original Medicare. Routine physicals. So how this works is Medicare will give you 12 months from whenever your Part B is in Bravo Medicare starts to go get what's called a Welcome to Medicare exam. And this one is a pretty thorough annual physical, but you only get that one time. So every year after the first year you've been on Medicare, you're going to get what's called a wellness visit, or what's commonly referred to as a wellness check. And this one doesn't go much beyond your height, your weight, and your blood pressure. So pretty limited in scope. Now, Medicare will cover some bigger ticket testing items related to preventive care. So things like mammograms, colonoscopies, bone density tests, a lot of different cancer screenings. Medicare covers that. But that actual office visit to go in and visit with your doctor, again, is going to be limited by the scope of the wellness visit. Some other preventive services Medicare will not cover: a routine hearing exam, a routine vision exam, and most of your dental care. Medicare is set up to cover you in the U.S. only, so for the most part, if you travel outside the U.S., there will be no coverage with original Medicare. And finally, we'll talk about prescription drugs not covered by Part A or Part B. So let me first tell you what is covered as far as medication goes under Part A and Part B. When you are in the hospital, any medication administered to you is going to be covered by Part A. Part B is in Bravo drugs. Medicare really decides what those are. Now, most of those drugs covered by Part B are going to be drugs that need to be administered to you in a clinic setting. So, for example, a cortisone injection or chemo is probably the most common example of a Part B is in Bravo medication. So you do have some coverage there, but pretty limited. And you know, most of us, when we get our medications, the doctor writes out the prescription, and we go to the pharmacy and get those medications filled. Those kind of medications, for the most part, are not going to have any coverage under Part A or Part B Medicare. To have that kind of coverage, you need to add a Part D drug plan. And although Medicare makes the rules on how drug plans need to work, drug plans are always going to be administered by insurance companies like Blue Cross. And we'll certainly spend some time today talking about our drug plans. Last thing I want to mention about original Medicare, and I would say the one thing, if nothing else, you should remember is up to the top, just to the right of that dollar sign, where it says original Medicare does not have an annual out-of-pocket max. Now, that means if you exceed the number of inpatient hospital days Medicare covers, not only are you on your own with no coverage, but there's no limit to what you're going to be paying. With outpatient services, we know now you're going to be paying roughly 20% of the cost. The big question here, though, would be 20% of what cost? You know, going in to see a primary doctor might not be too expensive, but you start seeing a specialist, maybe you get some MRIs, some CT scans, that ambulance ride, emergency care, that can be very expensive, paying 20% of which can still be a very big number. And again, there is no limit with original Medicare. I would say without a doubt, this is the number one reason why people will look at adding that extra supplemental coverage. And all the plans we'll look at in just a little bit that Blue Cross offers are going to do that. They're going to limit your out-of-pocket spending. They're going to put a ceiling on what you can spend on medical costs in a calendar year. Well, before we get into those plans, Blue Cross offers just a little bit of background about Blue Cross. We've been in Minnesota for over 85 years, and that does make us the longest running health insurance company in the state of Minnesota. We currently have well over 320,000 Medicare members. Now, that number represents about half of all eligible Medicare beneficiaries in this state. And the reason we have so many people consistently choose Blue Cross for their supplemental plan needs, one reason is because we have a lot of people at Blue Cross working year-round to develop plans with very rich benefits. Another thing, and a lot of people aren't aware of this, we're actually a nonprofit company. In fact, every dollar we collect from our members in monthly premiums, 90 cents of that is going back to pay claims. So we are very dedicated to being sure our members are going to maximize their benefits. And when they need to go get care, we're going to have their backs and be there for them. All right, so the first plans we're going to take a more detailed look at today are going to be our Advantage plans. Now, if you remember, the Advantage plans are one of those plan types that are regional. And again, that means the county you live in is going to determine which Advantage plans you're actually eligible to enroll in. In Minnesota, we have 3 different regions. We have the Metro region, the West region, and the plans we'll be discussing in more detail today, the South region. So if you look over to the right of your screen, you'll notice that map of Minnesota. And in blue, we highlight the counties that make up the South region. So you do indeed need to reside in one of those highlighted counties in order to be eligible to enroll in these South region Advantage plans. The network for these plans is also regional. It's primarily going to be made up of Mayo Clinic, it's the Mayo System clinics, but we also this year include Alina, and some other big ones would be the Olmsted Medical Center, the Northfield Hospital and Clinics, and the Winona Health Services System as well. These South Region Advantage plans have relatively low monthly premiums. In fact, they start at just $38.30 a month. Now, there's 3 in total different South Region Advantage plan options, all of which are going to include both medical and Part D drug coverage, as well as a lot of nice extras like vision, hearing, and dental. These plans, again, are only available to South Region residents, and we do have that focused regional network. If you do travel outside of Minnesota, but within the U.S., we will extend coverage to all 50 states. If you travel outside the U.S., your emergency coverage will go with you. These are also annual contract plans, and that simply means month to month, the benefits can change. Speaking of changes, we have made some nice enhancements to our South Region Advantage plans for this year, 2022. First of all, on our core and choice plans, the deductible for medications has been reduced. The monthly premium on our core plan has also been reduced. We've added comprehensive dental to our choice and complete plan offerings. We've moved to a copay method of payment for our radiology services and also for our diagnostic testing and x-rays. And finally, as I mentioned before, we have added Alina into the network for 2022. So great changes and enhancements we've made to these South Region Advantage plans this year. Not really changes that we've made to these plans, but definitely key features you're going to want to be aware of. First of all, that focused network. Again, Mayo Clinic hospitals are going to be the clinics and hospitals, the biggest chunk of the network in this South region, but also Mankato Clinic, Alina Health hospitals and providers are also in the network. About 63,000 pharmacies are in the network across the U.S., and really important here, there's no referrals needed. So if you want to see a specialist or get a second opinion, you don't have to talk to a primary doctor and get permission to do that. You can just pick up the phone and make that appointment. Now, if you do travel outside of Minnesota, but within the U.S., as I mentioned before, We extend coverage to all 50 states, and we give our South Region Advantage Plan members 9 months every year to travel around the country. If you do travel outside of the U.S., your emergency coverage is going to go with you, and only your emergency coverage. And that's a good benefit to be able to take with you. But I always do recommend to all my Advantage Plan members, if you're going to be traveling outside the U.S., at least consider looking at travel insurance. And we've got a great product at Blue Cross called Geo Blue. We won't go into detail on how that works today, but if you're interested in getting more information, please do feel free to follow up with one of our agents. Okay, well, here we have our 3 South Region Advantage Plan options. We have the Core Plan, that's $38.30 a month. Then we have the Choice Plan at $125.90. And finally, the Complete is $191.80 a month. Now, none of these plans have a medical deductible, and that's a good thing. A deductible would be the first dollar amount you would need to pay as a member before the insurance company started offering any benefits. So no deductible for any of your medical services on these South Region Advantage plans. Next line item is going to be very important. This is your out-of-pocket max. And remember, Medicare does not give you an out-of-pocket max. So how this would work on that core plan, in addition to the $38.30 you pay every month to have the plan, the most you could spend on covered benefits in a calendar year would be $6,700. If you ever get to that point, you've reached your ceiling. Now Blue Cross is going to come in and we're going to pay 100% of all covered benefit costs. Now you can see, moving over to the Choice and the Complete, that out-of-pocket exposure goes down. And that's because you're paying more every month in a premium to have those plans. And for most members we work with, this is the biggest consideration, finding that balance between what you pay every month and what you might be paying out of your pocket on the back end. Now, there's another out-of-pocket max listed just below the ones we just talked about. And you can see that's a little bit higher. That's where it says in and out of network combined. And that would be your out-of-pocket exposure if you get services outside of our network. So you still have a benefit when you go outside of our network, but it's just not nearly as good as when you stay in the network. And that's why those out-of-pocket maxes are a little bit higher. Now, per service, for services you get outside of the network, you can see on all the plans, you'd pay 45% of the cost. And again, that's only if you're outside the network. All right, so what about if you're in the network? Well, on the next slide, we'll talk about that. And what we've done in the column to the far left is we have identified some of the more commonly utilized medical benefits. And then you can simply slide over to the right to see what kind of copays you would have to take advantage of those benefits. And again, this would be when you're in the network. So starting with primary care visits, on all the plans, no cost. No cost to see a primary care doctor. If it's a specialist, and this would, for example, be an orthopedic doctor or maybe a dermatologist, you'd have a $40 copay on the core, $30 on the choice, and $20 on the complete. Lab services are going to be covered in full on all the plans. X-rays on the core plan would carry a $10 copay, whereas on the choice and the complete, there would be no cost. Now, if it's a more advanced type of imaging procedure, which would be, for example, an MRI, a CT scan, ultrasound, a little bit higher copay for those kind of imaging services. On the core, $95, the choice $70, and on the complete, still no cost. Your diagnostic mammograms and colonoscopies are going to be covered in full on all the plans. Outpatient diagnostic procedures, examples of this would be EKGs, pulmonary function testing, a sleep study would be another example. And on the core, you'd pay $25, the choice $20, and on the complete, no cost. Ambulatory surgical centers are going to be places where you would go for same-day surgery. All right, now these are not part of a hospital. They might be in a clinic or their own freestanding building, but they're not part of the hospital. And typically, again, you're going to an ambulatory surgical center for same-day surgery, like, for example, cataract surgery. The next benefit category listed, outpatient hospital surgery, well, really you're going in for the same reason, like a same-day surgery, only instead of getting it in an outpatient facility, you're actually going into the hospital, right? And then for most of the plans here, anything you get done service-wise in the hospital is going to be a little more expensive than if you get it done in an outpatient facility. You can see the exception there is on the core plan. Inpatient hospital. So if you're in the hospital and they're going to keep you there a few nights, usually they'll categorize you as an inpatient. And if they do, on the core plan, you'll have a $300 copay for the first 5 days you're hospitalized. After that, no further cost to you. On the choice and the complete, it's just going to be a one-time $150 copay, and that'll cover the entire admittance. So whether you're there 1 day, 5 days, or 50 days, it's just going to be that one-time $150 copay. And then finally, we finish up on this slide with emergency and urgent care, and you can see there's copays associated with those benefits. On the next slide, we're going to continue with medical benefits. I won't go through each of these line by line, but I will talk in a little more detail about the last line item, skilled nursing facilities, just because I get a lot of questions about what is that? And a skilled nursing facility is simply going to be somewhere you go to recover after you've been in the hospital. So a real common example would be knee surgery. I go to the hospital to have knee surgery. And, after a few nights, the hospital is going to want you to leave because they need that bed for another patient. But that does not necessarily mean that you'll be ready to go home and take care of yourself. So in that case, they would send you to a skilled nursing facility. Best way to think about this is short-term rehab after you've been hospitalized. All right, well, let's move in and talk about our dental benefits. Now, all three of these South Region Advantage plans are going to cover preventive dental, which means you get 2 exams, 2 cleanings, a set of x-rays, and a periodontal cleaning, which is just going to be a deeper gum cleaning. All the plans will also give you 2 fluoride treatments every year. The remaining benefits then from fillings down to crowns will be covered on the choice and the complete plans. And you can see fillings, you would pay 30% of the cost. Blue Cross would pay the remaining 70%. And for any other comprehensive dental benefit, you would pay 50% of the cost. So that's going to be our dental coverage. All right, so let's move into drug coverage. Now, first thing you need to know about drug coverage and drug plans is that there's a formulary. Right? So every drug plan is going to have a formulary, which is just a list of all the drugs that particular plan covers. Now, all the drugs that are covered by the plan are going to be categorized by tier levels. And if you look over to the column on the far left, you'll notice there's 5 different tier levels. The first 2 are primarily going to be made up of your generic medication. Tiers 3 and 4, you're going to be getting into your brand name drugs. And then finally, tier 5 drugs are reserved for what are called specialty drugs. On the core plan, there's no deductible for tier 1 and tier 2 medication, whereas if it's a tier 3 through 5, you can see you'd have a $350 deductible. After that deductible is met, then you would drop down into the cost sharing listed in the chart. And all the numbers listed in this chart are going to be for a month's supply of your medication. Moving into the choice plan, there's no deductible for tier 1, 2, or tier 3 drugs. If it's a tier 4 or 5 medication, you would pay the first $250. On the complete, you can see there's no deductible for any tier level medication. And this is the one plan we offer where our covered insulins are at no cost. Now, this is just where things start with drug coverage. If you'll remember, I mentioned earlier that Medicare has rules that all drug plans in the country need to follow. And one of those rules is called the coverage gap, or what you'll often hear referred to as the donut hole. So all these dollar amounts and percentages I'm going to go through on this slide are set by Medicare, and they apply to every drug plan in the country. So first dollar amount to consider is $4,430. That dollar amount represents what you as a member have spent on the cost of your drugs and what the insurance company has subsidized. So when those two numbers together add up to $4,430, you are now in the coverage gap, which means Instead of paying according to the cost sharing chart we just looked at on the last slide, you're now going to pay 25% of the cost for all covered medication. And you'll keep paying that 25% until what you and you alone have spent on your medication reaches $7,050. When you get there, if you get there, you have then reached what's called catastrophic coverage, and now you'll go to paying $3.95 for covered generic drugs, $9.85 for covered brand name drugs, or 5% of the cost of your medication, whichever one of those numbers is greater. And you'll continue to pay according to this catastrophic schedule until the end of the calendar year, at which point the slate is wiped clean and you start over. Now, this can be very confusing for a lot of folks, especially when they're new to Medicare. We do have a lot of agents in Minnesota that can make this much easier for you to understand, and that would be by running what's called a drug estimate. And that's where we'd simply get the name of your drug, the dosage, and how often you take it, and we can see for all drug plans available to you which one is going to be the most effective. And the one that's most effective is typically the one that's going to cost you the least amount of money for the particular medications that you're taking. All right, well, the extras that come with our Advantage plans, first of all, the over-the-counter allowance, that'll be $50 on our complete plan and $40 per quarter on the Choice and Core. And this allowance would go towards over-the-counter items, for example, vitamins, supplements, could be Band-Aids, bandages, toothpaste, bug spray, sunscreen are included as well. Silver Sneakers is our gym membership. So no matter which Blue Cross Blue Shield plan you decide to enroll in, the monthly premium you pay for that plan is going to cover a gym membership in full as long as that gym participates with the Silver Sneakers program. There are currently across the country over 17,000 gyms that participate, and you can join any one of them. And there's no limit to the number of gyms you can become a member of. Acupuncture, we're going to cover 20 visits for pain. Vision, we're going to give all of our South Region Advantage Plan members 2 exams every year, plus reimbursements for glasses or contacts. And that'll be $100 on that core plan, and it goes up to a $150 reimbursement on the Choice and Complete. All of our South Plan Advantage Plan members will also get a physical exam covered in full, and this is going to go above and beyond that someone limited wellness check that Medicare offers. You're also going to get on all the South Region plans a hearing exam covered with discounts on hearing aids. If you do have an inpatient hospital stay, we will send meals to your home afterwards. And finally, dental, we went through that. It's preventive on that core plan, whereas on the Choice and the Complete, not only is it preventive, but you're also going to get that comprehensive included as well. All right, well, let's move on now and talk about our Medicare supplement plans, or what are often referred to as Medigap plans. And these plans are going to have some unique differences from the other plans that we've talked about thus far. So let's start there, talk about some of the differences. First of all, with these Medigap type plans, your benefits are going to be guaranteed to renew. So that means as long as you keep paying your monthly premiums, you're going to keep the same benefits. You lock those in. Guarantee issue is going to be an important concept to understand. How this works is you're going to get 6 months from when your Part B Medicare starts to enroll in a Medigap type plan and have a guarantee issue. That means you fill out the application and you are accepted, no questions asked. However, if you apply after that 6-month period, in most cases, there will be a health history section that goes with your application, which means we're going to ask you about potential pre-existing conditions. Our underwriters are going to get involved and take a look at that, and they do have the ability to deny you coverage. So I always like to mention to folks, especially when they're going to be new to Medicare, if these Medigap plans look like they're going to be a good fit, not just in the near future, but in the long term, the best time to enroll is usually when you're first eligible, because that's usually the only time you have this guarantee to be accepted. Now, these plans are going to be available to all Minnesota residents, so they are not regional. So no matter where you live in the state of Minnesota, you can enroll in one of these Medigap plans, and it's the same plan, county to county, same benefits, same premiums. These plans are also completely portable. So wherever you go, this plan is going to go with you. Even if you move permanently to another state outside of Minnesota, you're going to take these benefits with you. Now, these plans are only going to cover medical. So you can't bundle a drug plan like with some of the options we looked at earlier, which means you're going to have to choose from one of 22 different drug plans available in the state of Minnesota. And some folks we work with like this because it gives you a little more flexibility. So the Medigap, again, only medical coverage, does give you the freedom then to choose from any drug plan available in the state. All right, well, your network with these plans is simply anyone who takes Medicare, not just in Minnesota, but across the whole country. So you do, in fact, have a very large nationwide network. Now, if you travel outside of the U.S., like the other plans we've talked about today, your emergency coverage will go with you. And although that's a great benefit, here again, I would recommend looking at travel insurance. And at Blue Cross, we have a great travel plan called Geo Blue. You're also going to get that Silver Sneakers program I mentioned earlier with these Medigap plans, and that's your gym membership. There's about 17,000 participating Silver Sneakers gyms across the country, and you can join any one of those and no limit to the number of gyms that you can become a member of. We also have local customer service, a 24-hour-a-day, 7-day-a-week nurse line. The Blue 365 program is going to offer discounts on health-related items, like, for example, glasses, contacts, or hearing aids. And we also have wellness programs and health coaching available for our Medigap members. All right, well, here we have our 3 Medigap plans. The high deductible plan, Plan N, which I like to refer to as the copay plan, and finally, basic Medicare Blue. Now, you'll notice in the first line we talk about the monthly premium. There's 2. The tobacco-free premium, self-explanatory. If you're not a tobacco user, you get that rate. The standard rate would apply to any of our members who have used tobacco in the last 24 months. So a little more expensive there. So the high deductible plan, $64.65 a month if you're tobacco-free. And not too surprisingly, there's a deductible. It's $2,490. So you would simply on this plan be responsible for the first $2,490 in any covered medical benefit costs. Now, after you meet that deductible, there will be no further costs for Medicare eligible services. Plan N, again, the copay plan, I like to refer to this one as, it's $189.60 a month if you're tobacco free. Now, before we get to the copays, you are going to meet the deductible, and you can see that's Medicare's Part B deductible of $233, and that applies to any services you get outside the hospital. After that deductible is met, there's 3 benefit categories where you will have ongoing copays, and I'm going to show you those on the next slide. Finally, we have the basic Medicare Blue plan. This is $245.40 a month. On this plan, like Plan N, you'll be responsible for meeting the first $233 in any outpatient benefit costs, but after that deductible is met, there will be no further cost for any Medicare eligible services. All right, well, next slide, we, in the column to the left, list some of the more commonly utilized medical benefits. But quite simply, on that high deductible plan, once that $2,490 deductible is met, no further cost for Medicare eligible services. On Plan N, the copay plan, once the $233 deductible is met, again, applying to any services you get outside the hospital, your 3 ongoing copays would be for office visits at $20, emergency at $50, and for urgent care, $20. Over on the basic Medicare Blue, once that $233 deductible is met, no further cost for Medicare eligible services. Now, it's important to note here with these Medigap plans, Medicare is your primary insurance. So all claims are going to go to Medicare first. And they're going to pay on those claims based on that benefit structure we looked at earlier in the presentation. Then the claim's going to come to us at Blue Cross, and we're going to fill some of those gaps and pay for some of those things Medicare does not. The key here is that the claim starts at Medicare. So for the most part, it needs to be a Medicare eligible service. And most things that are medically necessary are going to be Medicare eligible services, but there are some things to be aware of here. So for example, that second line item from the top. Remember back to the first part of the presentation, we talked about some preventive benefits Medicare does not cover. For example, a routine vision exam. So that's not going to be covered by Medicare. Therefore, on the high deductible and Plan N, there's also no coverage there. On the basic plan, you're going to get a little extra. You get $120 every year towards any preventive services Medicare does not cover. And what would that be? Well, again, for example, that routine vision exam. All right. Well, those are the Medigap plans. Let's next look at our standalone prescription drug plans. So these plans offer drug coverage only, and they're meant to be paired with the medical-only coverage you get from those Medigap plans we just looked at. Now, we have two different plans at Blue Cross that offer drug coverage only. They're called MedicareBlue Rx Standard and MedicareBlue Rx Premier. The standard plan is going to be $82.80 a month. The Premier, $116.10. No deductible for any medications for Tier 1 and 2. If it's a Tier 3 or 5 medication on the standard plan, you have a $480 deductible to meet. On the Premier plan, there's no deductible for any tier level of medication. Now, you'll notice in the column to the far left, we've got 5 tier levels, just like what we looked at with the Advantage and Cost plans. And so all the drugs that we cover are going to be categorized into one of these 5 tier levels. The first 2 are going to primarily be made up of your generic medication. Tiers 3 and 4, you're getting into what is primarily going to be made up of brand name drugs. And then Tier 5 is going to be reserved typically for what we call specialty drugs. Now, you'll notice there's 2 columns under each of these plans, the Standard and Premier, and that would be your preferred and standard pharmacies. We cover about 66,000 pharmacies across the country, and every one of those is either going to be preferred or standard. So examples of preferred pharmacies are going to be Target, CVS, Cub, Costco, Walmart, Thrifty White, just to name a few. The big standard pharmacy across the country is going to be Walgreens. Now, you can still go to Walgreens or any other standard pharmacy, but you can see the copay for medications at a standard pharmacy a little bit more expensive than if you get that same medication filled at a preferred pharmacy. Now, I mentioned earlier that Medicare makes the rules on how all drug plans in the country work, and one of those rules is called the coverage gap, or what's often referred to as the donut hole. And these dollar amounts and percentages I'm about to go through with you do apply to every drug plan in the country, and they are set by Medicare. So the first dollar amount to consider is $4,430. That dollar amount represents what you as a member have spent on the cost of your drugs and what Blue Cross, the insurance company, has subsidized. So when those two numbers, what you have spent and what we have subsidized together, reach $4,430, you are in the coverage gap, which means instead of paying according to the cost sharing chart we just looked at, now you're going to pay 25% of the cost for all covered medications. And you're going to keep paying that 25% until what you and you alone have spent on your medication reaches $7,050. If you get to that point, you have reached what's called catastrophic coverage. Now you're going to pay $3.95 for covered generics, $9.85 for covered brand name drugs, or 5% of the cost, whichever is greater. And you'll continue to pay according to that catastrophic schedule until the end of the calendar year, at which point the slate is wiped clean and you start over. Now, we do have one exception to this rule, and it's on our Premier drug plan. On that Premier drug plan, if you get into the coverage gap or the donut hole, Any Tier 1 or Tier 2 medication filled at a preferred pharmacy will actually be at no cost, as opposed to what we've looked at on all the other drug plans today where you pay 25%. So a slight exception on the Premier plan. Now, this can get a little confusing for most of our members because there's a lot of moving parts here. What we can do to make this easier for you is run a drug estimate. And that's something any of our agents would be happy to do for you. They just need the name of your drug, the dosage, and how often you take that medication. And we can look at any available drug plan to see what you would be paying for your medications. And we really are going to advise in most cases that you enroll in the drug plan that's going to cost you the least amount for your particular medications. And that drug estimate tool, again, best tool we have at our disposal to help guide you towards which drug plan will be the best fit. All right, well, the late enrollment penalty as it pertains to Part D drug coverage. So how this works is if you do not get a Part D drug plan when you are first eligible for Medicare, and then down the road you decide to pick one up, Medicare is going to penalize you. That penalty is going to be 1% of the national average cost of a prescription drug plan, which is somewhere in the neighborhood of $35 a month. So 1% of $35 is 35 cents, and then Medicare is going to multiply that by the number of months you could have had a drug plan, but you didn't. So you can see the longer you go without drug coverage, the higher that penalty potentially becomes. Whatever it calculates out to be, you will be paying every month on top of the cost of whatever drug plan you enroll in. And as long as you have a Part D drug plan, that penalty will always be there. So a lot of folks, especially when they're new to Medicare, they'll ask me, they'll say, look, I don't take any medications, or I'm on very inexpensive medications. Why should I take a drug plan? That's a good question. And one answer to that would be to avoid this penalty down the road. So just be aware that it's there. Well, medications can be very expensive. I want you to know there's extra help available paying for the cost of your medications. To find out if you qualify for any of these extra help programs, you can either contact Social Security or Medicare, and I've got those phone numbers listed for you on this slide. That brings us to the conclusion of this workshop today. I do want to thank you for tuning in, and remember, if you have any questions or would like to talk to one of our Medicare experts, feel free to reach out anytime. Thank you again, and take care.